pregnancy is always considered a blessing, especially in human beings. And the moment the baby bump starts to grow, the mother is filled with a lot of excitement. But have you ever taken a moment to think about pregnancy in livestock? How exactly can you tell if a cow, a goat, or even a horse is actually pregnant?
Mr. Job Malanda is back on the show to tell us the various way of pregnancy diagnosis in cows. This is Kilimo Bora Show. Join me, CoELIB Okoye, and
me, Emily Mbai, as we take you through this third edition of Kilimo Bora Show. Welcome. So, Mr. Malanda,
yes,
tell me, what is pregnancy diagnosis in general?
Thank you so much, and a pleasure to have you guys around here. Now, in my simple words that I would wish to describe pregnancy diagnosis, it's a technique that actually farmers or breeders would like to actually be able to use to establish the status of the pregnancy of their animals, whether the animal conceived after breeding or whether the animal did not conceive after breeding. Ideally is to find out does the animal has a conceptor or not.
Okay, now last time we were talking to you, we were talking about artificial insemination.
Great.
So if you can just give us an estimation of time, after how long after breeding can a farmer start determining a pregnancy diagnosis?
Anyway, in most cases, a farmer would wish to be able to get the certain status of the pregnancy of his animal even on that day. But the techniques that are available at the moment will be able to dictate the time. For example, as early as 20 days, a farmer can still be able to establish whether the animal conceived or not through various methods that we can actually be able to employ. Then onwards, from there until the time of the pregnancy, the status can still be established. So it starts from as early as 20 days onwards.
so what are some of the methods a farmer can use to do pregnancy detection?
Now you've asked a very interesting question. For example, in a farm setup like this one here, a farmer may not actually have the knowledge and the capability to be able to do the various techniques that are actually available, most probably in knowledge about what has actually been taught. But I would say one thing, that a farmer himself can employ a vast methods. There are around 6 or 5 methods that a farmer can actually have. Let me just mention some, starting with the most obvious, that on the 21st day of life after breeding, we expect to find out that did the animal conceive or not by looking actually at the return to heat. So just that one alone can be able to establish to us if the animal perhaps might have conceived after breeding. Then number 2, there are also other methods that involve the taking of samples from the animal. Like we have what we call the milk or blood progesterone assay, which is actually taken after around 20 to 21 days of breeding to be able to establish the increased levels of the progesterone in the animal's body. Now what happens is simple, that when the animal has an elevated levels of progesterone, then it's assumed that the animal is actually having a more production of progesterone from the CL. We call it the corpus luteum. Then number 3, I might actually be able to say that we also have another method called the PSMG, that is the pregnancy specific protein B test, which is only secreted from the trophoblast of the placenta of the animal. And you find out one thing, that even in the human beings, you have a placenta if you have something inside yourself as a woman, right? Now, in this case, the animal can only be able to secrete for us the protein that we are speaking about, the PSMG, if the animal has the placenta itself. Then number 3, we have what we call the ultrasonography, which nowadays is actually mostly being viewed by very many people as the most likely modern technique of doing the pregnancy diagnosis. And in this way, we actually look at the video from the animal system. Either we can do it outside or inside the animal itself. Then lastly, we have what we call the parectal palpation, whereby today we'll be able to demonstrate that.
So among those methods you've taken us through, which one is the best for a local farmer back at home who does not have any knowledge?
The best for the local farmer, I wish to say this, that the simplest. Now, the simplest for the local farmer, I wish to say this, that Parectal palpation, or what we call the rectal palpation, taking your hand inside the rectum of the animal to be able to view or be able to establish some organs into the system. That is the most efficient, effective, and less time consuming to a common farmer. That as a person, you wish to find out, is my animal pregnant when the technician comes through the PD. You want to find out the results there and then. Why do we do this? That's the most important thing. As a farmer, after my animal has been inseminated, or perhaps I myself have inseminated the animal, I will wish to find out, number one, have I achieved conception or not? Just to be able to evaluate my own capability as a professional. So doing pregnancy diagnosis tests my professionalism. Am I doing it well? Am I doing it bad? What should I do to improve? Then number two, we now come to you as a farmer, right? You need to know that this animal of mine, number one, it is pregnant or not pregnant so that I can maintain it in the flock. If it's not pregnant, I can look at another measure. Either I cull the animal from the system, or perhaps I can still be able to do what you call the repeat breeding. I do the repeat over it. Then number two, we need also to establish pregnant animals in the system so that we can actually be able to manage them well. We are looking at days like drying off. We need to establish when should we be able to dry the animals off, when should we be able to steam the animals. And then number last, we are speaking about how efficient is the management tool that we call AI, or perhaps service, being well employed into the farm setup.
Okay, now speaking about rectal palpation, I would like us to measure on that, since you have said it's the most preferred way. Now, speaking about that, before we get to the practical part of it, can you at least tell us how it's done? And are there any do's and don'ts when doing this method? Do we need a professional to do it, or can we teach a farmer and then they can do it for themselves?
Great question. I would wish to start with the last question that you've asked. Do we need to have a professional for us to do it? Of course, we need to have a professional, since rectal palpation, or what you call the parectal palpation, involves a technique that I should be able to find out what you call the structures, or perhaps the pelvic structures inside the body of the animal. And nobody else can do that unless you are trained on how you can be able to maneuver your hand into the rectum, be able to identify where is the location of organ what, or to a certain place. Then to come on to your second part, perhaps, how do we do it? Basically, we do parectal palpation by the use of the hand. And this is what we say, that it's one of the very basic, because you don't need actually to buy anything else. You only need to have your hand, then have your sleeve. When you have your sleeve, the arm length sleeve that you'll be able to take and do onto a practical animal. And then number three, you also need to have the OB lubricant to be able to lubricate your arm. Now you take your left arm, preferably speak about the left arm, into the rectum of the animal, and then you'll be able now to be able to try to maneuver around your hand, palm, and check onto structures that we call, let's say, the cervix, the uterine horn, the ovaries, and sometimes speaking about the membrane slip or the chorionic membrane. Now, those things will be able to tell you whether the animal is pregnant or not pregnant. Some might be there, some might not be there. So in most cases, we are going to look at what you call the ideal structures that will be able to get to us realizing positiveness of pregnancy and not negativeness of pregnancy. But in order less, we are going to look at them one by one as we proceed.
So we take, for example, a farmer was doing the process back at home, then they insert their hands inside the rectum. What are some of the effects the process can cause to the animal if not done well?
Great. A normal person always has 5 fingers with nails onto them. Now, it happens like this, that I'll come over, right? I'll be able to insert my hand into the rectum of the animal. My fingers are not short. What does it imply? That I'm posing a great danger, especially to, let's say, trying to be able to pair up or rupture up the rectal wall We call it the rectal wall. And in that case, the animal, after you take away your hand, the animal will be able to experience some pain because number one, you have been able to rupture the rectal wall of the animal, feeling pain, and sometimes the animal can actually be able to bleed. But animals sometimes do counter that process. In such a big animal like this one weighing around 0.67 or perhaps 0.7 tons of weight, it has a big mass, it has been actually able to consume well, and doing a PD probably like now late in the evening, we assume one factor, that the animal will have a lot of satisfaction, and hence it will be able to counter your taking your hand into the rectum by actually expelling the feces out, right? So in that case, you'll find a force. You are taking your hand inside, the animal is trying to thrust your hand outside by actually taking away the feces from the rectum of the animal. Yeah.
So do we have something like when we are talking about the other processes, we like the llama, we get to know that we have a specific time when the animal gives birth. Do we have a time which a farmer is expected to do the process, in the morning, at noon, or in the evening?
Great. There is no specific time for a farmer to do pregnancy diagnosis. If at all, he can choose any of the said 5 methods. But the specific time that we actually can say you'll be able to get precious results, if at all you gear yourself into doing what we call parectal palpation. Most of the parectal palpation will be most preferred. That is to be done if, number one, the animal has just come out from the nightshade. We assume the fact that it has not actually been able to eat so much, so it's not actually having a big force. But coming out from the nightshade and you doing the pregnancy diagnosis by parectal of the animal will not be able to influence their results. The only thing it will do is that you'll be able to get a bigger force of expulsion of your hand if you are doing it late when the animal has a lot of satisfaction, has fed well. But across the daytime, PD can still work well, whichever method.
Now, on that note, we will be taking a short break, but make sure to stay with us as when we come back, we will be doing rectal palpation in practicability.
We are back from the break. Remember, this is Kilimo Borasho. Like you said, this side of the interview, Mr. Job Malanda will be telling us practically the process of rectal palpation. Mr. Malanda, let's set the ball rolling.
Thank you so much. And here we have our animal. We brought our animal into our system. First things first, you need to restrain the animal best so that you can actually be able to do parectal palpation, since parectal palpation is a physical work that will require sometimes the animal might disturb you and move along, right? So for our case of our animal, this is a very big animal. We brought it into the head gate, perhaps the squeeze chute, a crash, or a cubicle, whichever place is appropriate for the farmer. So I wish to be able to start. The animal has been brought to my attention. I couldn't be able to tell, so I want to tell now. At what age, or perhaps is this animal positive of pregnancy or negative of pregnancy? But I don't know anything about it.
So now let's just get started.
Thank you. Great. Now with me here I have my kit, my small kit. And onto it I have also these other few things. I wish to say some few words before we now be able to progress. Ideally, I'll start by saying that you should be able to have the full equipment set. That is the first thing. I spoke about having an arm length glove. This is the one that you can actually be able to put on your arm and then get it into the rectum of the animal. Then you have the OB lubricant, then an spermicidal to lubricate the arm so that when you are getting your hand into the rectum of the animal, it is with ease. Sometimes the animal do have some feces that are very hard, right? And then they'll give you some problems, especially when you're thrusting your hand into the rectum of the animal. Then lastly, I have this, of course, like when we said last time when we were doing AI, have the tissue to be able to clean up the area of work. And then we can now be able to proceed. So I'll now take the pleasure to now start the process officially.
The pleasure is yours.
Thank you.
This is your moment, Mr. Malanda.
Thank you so much. So basic information first. As I am like this, I should be able to unsleeve. myself best so that I have a good opportunity of my hand inside the rectum of this big curve, right?
It's very, very big.
Yeah, it's huge actually. If you look at it very carefully, you might be 10 times. We don't know, right? So I have this with me.
Yes, all set.
All set. All set. I move closer to the animal. I have my tissue with me.
Yes.
Even though I will not actually mind so much using the tissue, since I need to get my hand inside the rectum of the animal, but tissue is best because you'll wish to be able to clear the fecal matter that is getting closer to the vulvar lips. That's just for the sake of aesthetic value, so that the animal is actually well. So basic things, I'll be able to clean up. Yes. We always start with clean up, right? Clean up. So I have my animal there. I pick my OB lubricant, right? My OB lubricant. I lubricate my arm. Slowly as we proceed. So you can close for me. You are my assistant today.
Okay.
That's great, right? So I use my hand that is not gloved. I lift the tail of the animal up, just the ways you can be doing in AI, right? Up to that point. Then get your hand inside using the left arm. For me, I preferably love to use the left arm of my hand, because in most cases, the pregnancy of the animal is inclined to the right. So I'll be able to get the pregnancy more easier than how I can still use the right hand that will actually face on this other side. You realize that when I'm getting my hand inside like this, I'll most probably face this side with my fingers and not this side. So it's easier when I get it from this other side, right? So there we go, right? Cone shaped, like we did last time, through it. Some animals might feel well, some others will feel disturbed, so they start actually trying to move around, and it's not better, right? Now, my hand is in. What should I do, right?
Exactly.
I should pass my arm slowly, gently, with no any force. If I realize that the animal is trying to struggle so much, I pause, right? Since I'm not in a competition to do a faster PD and yet man the animal poorly.
Yes.
So I progressively continue as I proceed. Some of the basic things that I should be looking at. Anyway, preferably, I would have been able to tell you that perhaps you will wish to find out small history about this animal. Let's say, did the farmer tell you that the animal was served or it was not served? Or perhaps it might be pregnant after having been run by the bulls unknowingly from the farmer. Then number two, you also look at the area of work. Sometimes you can be called in, right? You want to do PD, but the animal was actually in 2 or 3 days ago in the previous estrus. Hence, the animal will be having a ruffled tail with a snag, a bit of some mucus around here. So you also observe some few issues here, perhaps to find out that if the animal had what you call the last activity of estrus. Sometimes the animal will wish to be able to have issues about there's some dirt at the ram, meaning that these are the legs that were coming up onto it when the other animals were running over it. So it's definite that perhaps when you get to find out the PD of that animal, maybe perhaps you'll be inclining towards getting the animal in openness. Since it's definite that the animal that had estrus activity last 1 week or 4 days, there's a big chance that that animal is still open when you're doing the PD, right?
Okay.
So I proceed, I progressively continue. There are things that I look at, or perhaps I wish to find and feel, right?
Yes.
Others I can touch, others I can actually be able to have them by my fingers inside the rectum of the animal while I proceed. Then the first thing that I'm looking at is to be able to identify the cervix of the animal as the first landmark structure. The cervix is a hard substance. It's like a mace cob with a certain measurement of the length and diameter depending on the species of the animal. Some have long cervixes, some have short cervixes, right? Okay. So I'll be able to find out that. But now that one, finding it only does not indicate the animal is possible pregnant. Yes. That's positive or perhaps negative, because the animal can still have the cervix but not pregnant.
Yeah, so there are other things.
So there are other things that I need to look at. But now the cervix position can still be able to give me a clue whether the animal is pregnant or not. We look at the location of the cervix based on the pelvic prim. We are looking at, is it interior or perhaps it is exterior? But is it closer by here or is it far off, right? That one is a clue that we can have, but it's not a definite thing that we actually be able to get at.
When it's external, is it pregnant or not?
Now, when it's closer by, we call it out of the pelvic brim. That is somewhere just closer here. We get it by actually trying to sweep across the pelvic brim. There are two indications. That number one, this animal might be pregnant or the animal might not actually be pregnant. So for the pregnant part, we are looking at, is it an early calver, perhaps a heifer, still a heifer? That's why it's having the cervix closer here, or the animal that has not actually been bred for quite some time. Then for the cervixes that you'll be able to find, they are extended inwards inside the pelvic brim, of course, they're actually extending out from the pelvic brim internally, then the animal might actually be pregnant, since we are assuming the fact that the uterine body, that is now the body that holds the fetus, will actually have an extension of the cervix onto it. That's the cervix that is actually moving downwards. So those are some of the things that we are looking at. Then number two, for the one that is actually more close by downwards, we can have a scenario whereby this is an animal that has been bred for quite some time. It's like an animal that has been having pregnancy for the last 8 calvings. So for it, the cervix is still very, very, very big, and it can still be able to get lost inside the uterine body of the animal. So that's the first thing that we look at.
And the fetus die, perhaps?
Can the fetus die, perhaps, when I'm now doing this? That's why I said we need to do this practice gently, right? Gently. Even though at a very advanced stage, the fetus can not die. But when you're doing pregnancy diagnosis by parectal palpation, as early as 35 days, perhaps as early as 30 days, the assumption is one, that you are only going to look at what you call the membrane slip. The membrane slip is that the chorionic membrane that is closer at the diverticular point. And in most cases, if you manhandle the horns, right, you can actually be able to squash, right? How can you do it? Like this, yeah? Yeah, so that now the animal will not actually be able to possess the pregnancy. So those are some of the risk factors that we look at. Can you allow me to proceed?
Yes.
Yes. So I can now be able to proceed. And I have been able to get to one big thing, which I can be able to declare, right? So I proceed very well. Sometimes for the bigger pregnant animals, we can still be able to feel what you call the corangles and the placentums onto that is inside the uterus of the animal. And at this point here, I am well to say that I'm feeling actually the mouth of the calf here, right?
Wow.
Yeah, this is now the head I'm looking at. Then it probes me now to make judgment faster enough, right? Yes. But I will not wish to do so, since I would like to advise the farmer. Just getting the animal pregnant is like less than 2 minutes, right? But it will be more better to tell the farmer that it's pregnant at this age, so that the farmer can now plan some few things onwards, right? Yes. So for this animal, if I were just to come and look at either positive or negative, then I would be far away, have taken my hand outside from this animal system, because the animal is possible pregnancy. What am I getting? I'm feeling the muzzle point of the calf, right? I don't know the sex. I don't know if it's a male or a female, but I pray it's a female. I pray. Now.
So now tell us about aging, about how you can tell whether the calf is maybe 2 weeks old, maybe a month old. Can you be able to tell that?
Yeah, your question is very tricky, because 2 weeks old, I would say, I wish to say one thing, that when we breed our animal, the animal has to take some period of time to be able to recognize that pregnancy. We call it the paternal recognition of pregnancy. And that one takes up to around 14 days. That's the time when the animal will recognize that, oh, I'm pregnant, right? So what should I do? I should not come again into heat to be served now. I should maintain the pregnancy, right? So at that point, we might not actually be able to establish that this animal is pregnant at 2 weeks. But at 20 days onwards, with the tests that we have been able to speak about, the milk and blood progesterone assays test, the PSMG, and the ultrasonography, we can still be able to establish. For parectal palpation, and you want now to do the aging. You want to find out, is it 3.5 months, 4.5 months, 5.5, or perhaps whichever, right?
Yes.
We look at two things, right? Number one, we would like to look at the size of the fetus itself, right? Then number two, you want to look at the size of the uterine body itself. And then perhaps when I add on to it, number three, we are looking at another artery that we call the uterine artery. We also speak to it as what we call the Fremitas artery. That artery is always ipsilateral. I know the word ipsilateral might be hard for you,
exactly.
But inclined to the side of pregnancy, right?
Oh.
Yeah. So we do aging like this. Since a cow is a domestic animal and we'd like to be able to get most of its features, perhaps for the pregnant status, with the things that we know domestically, like rats, cats, right?
Yes.
So as early as around the 2.5 months, or perhaps around 40 to 60 days of pregnancy of the animal, if we get into the system of the animal, the conceptualize as, we described as a small rat, very small. You know the size of a rat?
Yes, a rat.
Yeah, small rat, right? So as it progresses up into around 3 months, 4 months, it becomes now a big cat, and onwards a small cat, onwards a big cat, and then at the end of the time, right? So for example, for mine here, right? Mine here, I wish to say one thing, right? Let me now do what you call the aging. I was doing the PD, right?
Yes.
But now I want to do now the aging. Now the aging for this animal, since I'm now feeling the muzzle point here, I'm even able to touch the gums there for the calf here, and the calf is actually standing up well, or in its presentation well. So this calf here, for me, if I look at that, right? Because if I'm able to get now the calf at this stage, with that feature of I'm now able to get to the muzzle of the animal, or perhaps the mouth, then I know most likely the animal is at what we call the 3rd trimester of pregnancy. 3rd trimester of pregnancy, 6 to around 9 months, right? So this animal is perhaps 7.5, 8 months of pregnancy as we look at it.
Oh.
When it advances more, right? When it advances more to around 8 months, or perhaps even close to 8.5 months, you now get the calf in a dog sitting position, right? We call it a big old dog. So that's actually how you'll be able to get the calf inside the system of the animal. Aging is best because of 4 reasons, or perhaps 3. Number one, you as the farmer, right? Let's say you are a town farmer, right? You are an urban farmer. You also manage your farm by phone only. You don't reach the farm setup. You don't meet your animals. So you are just ask, was that animal served? Then the herder will tell you yes or no, right? But you never know if the records were kept. So number one, we need to establish aging, not actually the PD, aging of the pregnancy, to establish, number one, is the animal able to be dried off or steamed up at the right time? Number two, we need to do aging to find out if the animals perhaps were run over by the bulls, or maybe the records were lost. So at what time are they going now to calve for us, so that we can actually be able to establish the goodness about now doing the aging over the animal well. So I believe at that point I can still be able to say that we are well with this big...
Okay, now, Mr. Malanda, I think we are done.
Yes, we are done. So gently also, right? Gently in, gently out, right? So gently also. I believe you can see that my animal is just calm, right?
Yes.
Yeah, it doesn't have any issues. So we get it out, Paul.
So maybe if you can just give us figures about those scientific methods of milk and those protein testing. If you can just give the local farmer a figure.
The local farmer, I can actually be able to say this, that it depends with the lab where the person can actually be able to take the sample. But I'm best assured that it can never be something less than 2,000 shillings to establish the pregnant diagnosis. By getting those methods done well in the laboratory, samples have been taken there. But for the pregnant diagnosis, if I are the one to charge, maybe I can say this, that above 7 months, I do it for 200 shillings or less. Then if it is below 7 months, like 6 months, 5 months, where now the farmer is having a dilemma, is it positive or negative, right? So now I now have my skill of work. We're now going to be able to make the cost go up. So I can do it at 1,000 shillings, right? And when it's still very early, like around 4 months or 5 months, then I can tell the farmer that now we're now going to take the animal's pregnancy diagnosis test, and this is an early stage, but we're going to charge you this amount of the money.
So Mr. Malanda, let's take for example, we have a local farmer back at home who is doing this process, but he or she is not a professional. Then by bad luck, he interferes with the calf inside the cow, and the calf dies. What way next?
Good. What way next? Quite unfortunate. The farmer will have lost. The animal will have lost. What will the farmer have lost? The farmer will have lost, number one, the expecting calf to be born. What will the cow have lost? The cow has lost the pregnancy itself, right? So it's quite unfortunate. But now speaking about what next, right? What next? In such like scenarios, we advise that the animal to be treated, because it's like the animal has now been able to go into a stage that we call an induced abortion, right? So you might handle the animal inside, and then the calf has actually been able to come out, perhaps whichever the most probably the root of the vulva. So in such like scenarios, we say that we assume what we call induced abortion. Perhaps not actually voluntarily, but you are not actually having the mindset or the intention to do that, right?
But you just have to do it.
Yeah.
So that has been it this week on your show, Bimobora. We have talked to Mr. Malanda, who was given us an insight about pregnancy diagnosis, the various methods, the importance, and the practicability about how this process is done. Please make sure to stay with us next week, as we will be covering artificial insemination in chicken. I have been your host, Emily Mai.
And